Time is now 9:14. Heart disease is the leading cause of death for women in the United States. During American Heart Month, we've been exploring a number of topics relating to heart health, and today we want to find out what women should be asking their doctors when it comes to heart disease. This morning we're joined by Dr. Sarah Schwertner with us from Primary Health. She has some both questions and answers for you. And the biggest myth, good morning, Dr. Schwertner, that you want to bust this morning is that heart disease does not always equal heart attack. Clarify that for us if you can.
Right. So heart disease can be a number of things. It can cause a heart attack, but it can also be arrhythmia. You can have congenital defects at birth. You can also have different things like congestive heart failure, where your heart is not pumping properly, and those are all types of heart disease.
And are all of those deadly necessarily immediately, or more deadly than others?
So, a heart attack can be deadly if you had narrowed vessels to your heart. Congestive heart failure can take time, 10, 20 years to actually give out. So it's important to ask your doctor, what are your risks for heart disease?
And that's what I was going to ask you. We go to these checkups every year. Your doctor always asks if you have questions. With heart disease being so deadly among women, what should women be asking their doctors during these appointments?
So you should basically ask your doctor, what are your risks of heart disease? Things that can cause higher risk are being overweight, being non-active, not exercising, having high blood pressure, high diabetes, or high cholesterol. And so you want to ask, what's your number? So I'd ask my doctor, what is my number for high blood pressure, diabetes, and high cholesterol, and work towards getting it lowered.
Is body mass index something you should be asking your doctor to check when you're in these appointments?
Absolutely. That's one of the things we always look at when you come to an appointment. What is your height? What is your weight? The higher the number is, the more likely you are to have heart disease.
I know we're in South Louisiana. We're always in a season, be it Christmas, be it the New Year, be it Mardi Gras festival. Mm-hmm. Of course, we love to eat, but diet, is that something that you should be discussing with your doctor during these appointments as well?
Yeah, so you want to ask your doctor, what is a heart healthy diet? And one of the examples of that is whole foods, lean meat, nuts, seeds. All of those are a part of heart healthy diet.
When it comes to your chances of stroke or other forms of heart disease, what kind of questions should you be asking your doctor as far as your risk is concerned and how you can lower that risk?
So you want to ask what types of exercise are good for your body. So what the general rule of thumb is 30 minutes of cardio as many times a week as possible. Even if you're at home and it's cold and you don't want to go outside, you could even run in place in front of the TV.
I know, back to the diet thing, it's again hard to always be eating right, if you will, this time of year. But what are just some suggestions maybe to add or subtract so you could still enjoy whatever festival or season we're in, but still keeping your heart health in mind, especially for women?
So, everything in moderation. So, if you want to have a little bit of king cake, try to just have a little tiny piece and then increase your chicken or grilled fish and vegetables. So all those things that people might love, fried foods, maybe have a little taste of that fried shrimp instead of having a big shrimp platter. And then, increase your salads, nuts for snacks. I always tell my patients, jerky, low sodium jerky, turkey jerky, cut up vegetables. Those are really good for your heart health.
Well, doctor, we hope these tips and reminders are helpful to women. I know we're kind of still in the beginning of the year, so people are still setting those annual appointments. So hopefully they took some notes and, they watch this back later on online so they know what kind of questions to go into those appointments with so they can be heart healthy. We appreciate your time this morning.
Thank you.